Hi everybody, it's Cameron Tudor here from West London Physio and Covent Garden Physio. Just doing a short video for the MSK Partners Network on the challenges that we face in relation to providing remote consultations. By way of background, we've got two clinics in London. We see our patient mix is a combination of post-op rehab, sports injuries, dance injuries, together with our generally sore necks and backs. It's probably similar to your typical city-based private practice. The two challenges that we see, one is a demand side challenge. There's no getting around that we're just going to be seeing fewer patients now. The activities that are conducive to injury aren't being performed anymore. The marathon's not going ahead, so we're not getting the marathon training injuries. The ski season's been cut short. We're not going to get those ski injuries coming through. The West End musicals, they've been cancelled, so for us, we're not going to get any of the dance injuries. So I think generally we're going to be there's a general suppression of demand, and that's not going to change during this time, I don't think. The second challenge is, how do we get patients on board with one-to-one consults? For us, it's just about educating, making sure that you're telling them what conditions are conducive to remote consults and what conditions aren't so conducive to remote consults. So those patients who are used to coming in for whatever better description, their maintenance, when they're coming in to get a general loosen up, to make themselves feel temporarily better, or to get a bit of a loosen up before an event or a performance. We're not going to see those patients, and we probably can't help them in the same way that they want to be helped or have been helped in the past. So I think it's important to educate patients as to really what you can deliver on, and when you outline that, make sure that we over-deliver and help them with the same enthusiasm that we would face-to-face. So the conditions that we're finding work really well for remote consults, obviously the post-surgery stuff, I think that'll dry up significantly, but for now we still have a backlog of post-surgery patients. We have things like total knee replacements, ACL reconstructions, your scopes. Those procedures work really well for remote consults. And in fact, I had a patient who I rehabbed completely from a total knee replacement last year, just using FaceTime on our mobile phones. I think we had 5 or 6 sessions over the course of 3 months, and her outcome was excellent, as good as it would have been had she been here face-to-face. So I'm a big advocate of remote consults for the post-surgery cohort. I think it works really well for back pain. For the acute back pain, we've got advice and allaying any fears, so educating the patient that their back pain will typically get better. But we can also manage the subacute and the chronic back pains pretty well with exercise. And in fact, that's mostly how we do it these days. Most of these patients, their long-term benefit will come from progression through a well-structured rehab regime. And so we can do that really well remotely as well. The posture-related pain, I think we're seeing a lot of patients now working at home, working on a laptop. I know sitting here now, my neck is getting sore as I'm talking to you. I should have it on a couple of books. But lots of patients are getting that, and we can do home-based desktop assessments really quite well remotely. So they're probably the 3 areas that work best. And also the acute injuries, the patient that's gone out for his 1 hour of exercise a day and sprained their ankle. Well, we can provide acute advice there, and we can still provide advice on whether something needs to be imaged, and we've still got a network of consultants that are happy to see patients where there's a concern as to the severity of the injury. How do we deliver it? Well, we deliver it simply. So we use either FaceTime, Skype video, Zoom, Skype. They're all secure. Depends on what the patient prefers. Sometimes it depends on whether if we're wanting to get a broader view. FaceTime is less good compared to something like Skype. If we're wanting to record, sometimes we want to record the consultation that we can send to the patient, then we can do that better on Skype. We follow up the consultations with an email to confirm what was outlined. We often do that with our face-to-face patients anyway. And we follow up with exercise. We use Physiotech software, which I think is excellent. And we send the patients their exercises. They've got access to video. It outlines pretty clearly exactly what they need to do. And that's broadly it. We keep it simple, and the feedback has been good. There's no doubt it's a challenging time, but there's also no doubt that remote consults can be exceptionally good value for patients. And so long as we educate them as to the benefit and professionalise it as much as we can while keeping it simple, I think they're a really good service. So hopefully that's what we do, and hopefully you get something out of that.